Polk, and I'm here with Ann Langston. She is the Senior Director of Strategic Partnerships and Opportunities here at Church Health. Welcome, Ann.
Thank you.
So we're just going to jump right in. Could you tell us how to organize your business?
How to organize your business when you get started. Well, there are decisions to be made about whether you want to be your own independent, not-for-profit organization or whether you want to be affiliated with another one. Oftentimes, most likely candidate to be affiliated with would be your church and to come under that umbrella. Church Health made the decision very early on because we wanted the support and connectivity for a lot of churches that we needed to be our own independent 501c3 tax-exempt organization and to have our own not-for-profit status in the state. I think most clinics go in that direction, but some may be under the auspices also of a hospital or of some other entity like that. But it needs to be planned early on so that you get off on the right foot and have all of your I's dotted and T's crossed in a legal organizational sense.
Who needs to be on the team when starting the organization or a clinic?
Well, I would say it's really about getting the planning team together and not getting the clinic started as much as what kind of clinic are you going to have, and a lot of decisions to be made. The first, probably, and most important person on the team is to do a lot of work around who will be the team leader. Who is that champion? Who is that charismatic person who can open doors in the community, but more importantly also has a vision and wants to work really hard to make that vision come true. I think all of the clinics that we have seen that have been successful have had somebody that had that passion. They don't have to have a particular title or skill set. They don't have to be a doctor. They don't have to be a minister. They don't have to be a nurse. Many people are just lay folks that have a tremendous passion, but an organizational ability to both garner support and to get things in an organized manner off and running. So that's the key person on the team. Recommended would be several other people that would really help bring things together. Clearly, legal counsel is important on the early team to get things set up correctly, to make sure that, but not just the organization, but the way in which people are being informed about how you volunteer, how you get involved, what status the entity has and the like is important. And then somebody that is a really good networker in the community, depending on what community that you're in, somebody that can open doors for volunteer physicians, somebody that can open doors to churches, somebody that just knows folks. They don't have to know them all themselves, but they have the ability to do that. I think a financial advisor is very important, someone that can help understand setting up budgets, unless your champion has all of those skill sets, which one person doesn't usually have, but somebody that can help design a budget, be logical and thoughtful about what salaries need to be put in place, and also how to get your financial accounts all set up properly. The other people that we would recommend you consider being involved, depending upon the community, is someone or multiple people from the local hospital and also the local health department communities. These are people that have the relationships with physicians in the communities and also become champions.
When talking about starting up, how critical is confirming or getting a great location for your clinic in record keeping within your clinic?
Well, certainly location is important. I think that it is critical to look at who you want to serve in the community and make sure people are going to be able to do several things. Number one, find it. It needs to be a location that's not hidden and on a street name that nobody's ever heard of. Two, you need to look at transportation. Do people have the ability to ride the bus? Can they get rides? Is it close to where people live and work? So that's very, very important. And I think visibility in the community is also a very helpful thing, because as you garner support across the community, if people drive by and they see a nice looking facility and something that they identify with, they're more likely to want to get involved. Record keeping, that was another question that you asked. And record keeping, of course, with my background here and practicing law, I think record keeping is one of the things that startup not-for-profit organizations often overlook. It is, okay, I've got this little notebook and I'm writing it all down, and when we need it, I'll be able to go back to that page in my notebook. In this age of everything being saved digitally, it's a wonderful step up from when many clinics got started. But getting a program where you are keeping track of everybody that ever gives you anything, whether it be a pair of crutches or $1 million, keeping track of that information is really critical. Having great records for legal is important, all your status is important, and then I would include in that getting good records set up from the beginning on your human resources. You won't have a human resources department or person to rely on, but having a way to keep track of all of the information around benefits, salaries, and a good system in place. And then last but not least, clearly the other most important thing is your financial records. And getting an accountant or somebody involved right from the start to keep those records in place, and also to be able to take a role in getting an audit. We strongly urge a new organization opening a clinic to get a full audit from the beginning, because many of the funds that are likely to be sought in the early years are going to be from foundations, and foundations want to see more than just a compilation or review.
Could you give us some legal background about how to get things rolling as far as obtaining your tax-exempt status and becoming a healthcare provider?
Okay. Well, the first thing I would say is you need to hit the streets and find a volunteer lawyer. If you're going to find and recruit volunteer physicians and volunteer nurses, I think it's also important to ask the legal community to step up and help. Clearly, you may have to pay fees for applications, but if you can get your legal services donated, I would encourage you to do that. It is a process that takes some time, depending upon where we are in time with getting a tax-exempt status from the IRS. Sometimes it can take as little as 30 days, sometimes it can take 6 or 8 months, depending on the staffing and all at the IRS. So it's something that needs to get started fairly quickly. You don't have to have your full board of directors in place or any of those other decisions made, other than knowing your purpose, knowing kind of who the initial at least 3 board members will be, and how you plan to operate, what your activities will be. It's important early on to make those determinations and draw them broad enough that they will last you throughout the career of the organization.
Okay. So what general advice would you give any of our viewers right now that's about starting up a clinic? Or
put together a team that's enthusiastic, that wants to work, that is action-oriented, that doesn't want to spend a year trying to figure out all of the details, but is willing to jump in, find a location, get a corporation up and running, and then build that network of early on support. You also need somebody then on the other side that'll tend to the details. I will say that most likely will be a nurse or someone that is used to paying attention to details, probably not your first physician in the clinical side, and letting that person run with that. Getting those folks in place and off and running is good. And then always have somebody that is probably non-medical involved that will take care of all those other things I mentioned and would come on board almost as though an office manager or a volunteer that would work on financial records, keeping a database, those types of things. And most of all, have fun and feel the gratitude that will come if you do this hard work, and the many, many people that will be blessed by the work.